Joining me today is Peter Wright, the CEO of Valley Regional Hospital. So Peter, thanks for being here.
My pleasure. Thanks for having us.
So I guess my first question may be just a little bit about you. How does one get into running a hospital?
Well, I'm not sure that I'm the perfect test case. I think that most of my predecessors went to school for healthcare administration. They do their residency, they spend time in an organization, and then migrate their way into management. I was not born and bred in healthcare. I spent time in resort management. I was in law enforcement, a variety of different careers. I got into healthcare through a college friend who advised me of a position that opened up at Copley Hospital in Morrisville. And I was working in that position for about 6 months when I was driving to work one day and just couldn't wait to get to work. And I remember thinking, I'm going to do this for the rest of my life. And, so I worked through the ranks there. I had a great mentor for several years who knew what my objectives were and helped me go down a path that prepared me for this job.
So do you see the healthcare industry different because of that different experience?
It's hard to tell. It's all I know. But
Right.
I tend to see it differently. I tend to bring a slightly different perspective to the table when in a group of my peers. Not vastly different, but through a different lens about how service plays into the role. Based on my background, you know, my mom owned a restaurant when I was young, and service was pounded into me from a very early age.
And I imagine as we look at the market, I mean, when you talk about service, what do you see as the needs for hospital service in this region of?
Well, this is a unique region in the Upper Valley. If you're, say, in Claremont, there are 6 hospitals within 35 miles. So the old idea that proximity was all that you needed, you just went to the local hospital, which is what happened kind of back in the day, is gone. People are willing to travel to providers. They do so all the time. And so we have to create a reason for people to choose to come to Valley. And part of our plan is to do that through service, through good clinical care. Mm-hmm. That's a given. Everybody expects that today. And you know, I think part of the quality race, if you will, is it's up the bar for everybody. And there's really significantly better quality in the healthcare industry today than there was 5, 10, 20 years ago, you know, incrementally.
And so do you get people from Vermont coming over too? Does that work with the insurance component there?
We do. It's a little difficult. Most of the folks that we have who come from Vermont usually are employed in New Hampshire. There's a big line in insurance companies mostly because of the regulations. Don't usually cross it. MVP is a classic example. They announced earlier this year that they are out of the New Hampshire market totally. We've reached out to him and said, you know, okay, you have some covered lives that work in Vermont that live in New Hampshire and they use us. So we try to play nice in the sandbox, but you know, insurance companies have very strict standards about what they do, and we do the best we can to work within those.
So, I mean, is that really, does dealing with insurance companies, I imagine it takes part of your day, but does that drive a lot of every hospital administrator's strategic thinking?
It does. You know, I think it's less so than it used to be. Competitive insurance contracts used to be big business. You know, how shrewd of a negotiator you could be, how good of a deal, how high of a rate. Nowadays, I think we're driving more towards population health. There's been an effort for a number of years of what we call living on Medicare. So Medicare and Medicaid are traditionally the lowest reimbursement that we get. And now there's a drive for everyone to get to that Medicare rate. And so we're trying to figure out how to become less expensive, where if you were talking to me 10 or 15 years ago, we would try to figure out how we can maximize our reimbursement, how we get the highest reimbursement.
And so, I mean, is technology helping you become more cost efficient?
Sure.
Or harming that process?
I think there are pieces of technology that help us be more efficient. That said, the more and more technology we have adds to our overhead and infrastructure, the cost. So it cuts both ways. Certainly the increase in healthcare costs over the last 10 or 20 years are because of new technology, whether it's more advanced lab equipment. Diagnostic imaging is probably the biggest driver of technology, and then often technology that you don't see. Computers, networks, the basic IT infrastructure. We should probably spend a third of our capital budget on IT that really adds no value to the quality of care. It just allows our staff to work.
Well, we're out of time in this segment.